All right, another sit down video. This one, I'm watching Think Big Bodybuilding right now. It's live. And I came across on Amino Asylum because I used their code THINK to save 20% off the order off Amino Asylum. And guess what they are now having available for you to purchase? Semaglutide. You probably have seen this and heard about this. It's the miracle weight loss drug. It's an injection. It is a GLP-1 receptor agonist. What is that? It's a glucagon-like peptide, and pretty much it's just going to help increase the amount of glucagon to help stop hunger, stop cravings, and it's prescribed to people who are in the BMI obese over 25 a BMI, right? 25, 27. So really, let's share the screen and let's look at Amino Asylum and see what's going on here. This is a very, very popular drug. The reason why, again, like I said, it's a miracle drug as far as the weight loss and how it does help with glucagon production. So it agonists, so it helps make more. So this right here, if you follow my cursor, semaglutide, they give you 5 milligrams for $70. Now, what you don't talk about really is the cost of semaglutide. I believe insurance won't even cover it unless it is a cardiovascular risk or there's some other risk for your obesity, because obesity, it is a lifestyle choice. That's your decision to make. You have the power to get up and to move and to eat less and to better yourself. You are causing this issue to worsen your health. And so the same thing to where insurance company may not cover the cost of a new liver if you drink and cause yourself cirrhosis and you do it repetitively if you're drunk. Okay, I've been in hospitals and worked in hospitals, and I've seen it happen where people, they can't get a liver because they can't get on the donor list, right? Or they can't afford it, but they cause that problem to themselves because there are less fortunate people who have done more to try to extend their life and make good habits. So it costs like $1,000 a month for semaglutide, okay? And semaglutide, if we look at it, on Google, so let's go ahead, and it's going to be my search browser because I've been searching for stuff. So it looks like this, okay? So there we go. So you've probably seen this, the Wegovy, the Ozempic, you've probably seen those pens, okay? So each dose is usually around 1 milligram, 0.5 milligrams. It's usually where they round it out, okay? However, there's a study regarding the semaglutide, okay? This is from the American College of Cardiology. So usually, like I was saying, it's gonna be 1 milligram is what's prescribed once a week, okay? The effects of this, you're gonna have weight loss. It's just gonna happen. Even if you don't do anything, right? You will have weight loss. There is somewhat of a diet control because you can't just continue to eat more. So as long as you have a diet control, you're on a calorie deficit, but you don't have to move and you're going to lose weight rapidly. We're talking like 1 milligram, you lose 7% more body fat than or body weight, because they don't distinguish body fat, but body weight in general, than someone who got a placebo, which was like 0.2%, okay? 7% to 0.2%. That's crazy, right? So usually it's going to be a long period of time as well during these trials. So we're looking at 68 weeks sometimes. We're looking at 36 weeks, a longer period of time. The drawbacks with semaglutide is that it does cause nausea. So that is some of the results of having less hunger. So you're trying to change the chemicals in the brain. But this is cool, man, because if you're talking about one shot per week, so so what is I almost closed myself out of this. So what's cool is that Amino Asylum, they're giving you 5 milligrams. This is 5 weeks. 5 weeks. If you do 1 milligram, so if you're on a diet, if you're on a contest prep, or if you're on a new, just a new diet and you need some help from those cravings, 1 milligram once per week, that's 5 weeks. That's going to be great, man. That's great. So great deal. And other people are spending, $1,000, right? But in the American College of American College of Cardiology. There we go. Come on. They actually did double the amount. Okay, so they went up in this one study once weekly, 2.4 milligrams. So you can actually, maybe do it twice a week. So 1 milligram, 1 milligram would be the route to go, in my opinion. So then that bottle would last you 2.5 weeks, right? Still a great deal, still $70. Actually less because you're saving 20%. Remember code THINK? So they lost 15% reduction versus 2.4% reduction over 68 weeks. Okay, that is awesome. Obesity, type 2 diabetes, it is a major causation of cardiovascular and cardiometabolic factors. Okay, we know this for a fact. So this article about this clinical trial, it goes over that. Okay, it shows the progression of the participants. Okay, and the dose, they were titrating it up over 16 weeks. Okay, so they didn't just jump in to 2 milligrams per week. So I wouldn't, but that's 175,000 participants. Okay, 175,000. That's like 0.0000001% of American population who are obese, right? Who would most likely qualify for this. So if you start off on half a milligram, maybe for a few weeks, right? Maybe 4, 5, 6 weeks, and then bump it up to 1 milligram, and then continue that, and then bump it up to 1.25, and then 1.5. I mean, that's the way to go, in my opinion. This Amino Asylum, I mean, snag yourself, 6 bottles, 7 bottles, 8 bottles, whatever you can do, save 20%. You would have, over a few years of helping you lose weight or during contest prep. So if you're just a lifestyle person, this can help you. This can. But remember the risk of nausea, okay? But if you're in a contest prep, this can help those cravings, okay? It can chemically change those cravings for you. You just won't be hungry, okay? Now, you might eat, right, out of boredom. Sometimes there's nothing you can do about that, okay? Maybe boredom, depression. There's a lot of other factors that may cause cravings, cortisol and things like that. But the GLP-1 receptor agonist is supposed to help control cortisol. It's also supposed to help control your HbA1c. Okay, so your glucose level within the blood, it's supposed to be more manageable. So definitely bringing it under 5, right? So that's going to be great. So that's a way that we can see how it can control some of these problems that type 2 diabetics have, okay, with a higher blood glucose level. So you also can get rid of some of those cravings, because when your blood glucose level is high, it can cause some of those cravings. It can cause a hormonal imbalance. It can cause cortisol to be spiked. So my opinion is to get this semaglutide, right? Amino Asylum has not put out something that doesn't work. I have not used it. I don't need to use it, obviously. If I were, for some reason, contest prepping, which I won't do, I would definitely use it, right? For sure use it. I would for sure do 0.5 milligrams, for sure. Okay, Derek for More Plates, More Dates, Vigorous Steve, they have tried it, okay? And they both say that there is nausea. This is the way that Vigorous Steve got through some of his long periods of fasting, or how he was doing like vegetable fasting, OMADs, or whatever he was doing to help lose some muscle mass, because he needed to lose some muscle mass. So this does show it's not just body fat, okay? You will lose some muscle, so it's weight loss, okay? So we're talking about tissue from fat, tissue from muscle, maybe visceral fat. That's where we're really trying, that's what he was really trying to get rid of. It can help with lowering your A1C, ALT, or A1C, ALT, AST, so your liver can be healthier, which helps aid in fat loss and overall just well-being, and aids in the fat loss of the visceral fat loss, okay? So the fat that's around your organs. So in my opinion, this is freaking awesome that Amino Asylum has put this out. So semaglutide, telling you, it is revolutionary for what it is doing. However, it's been around for a very long time, okay? So it's been around, it's kind of been unknown, but it's been around for other various reasons. And they just found out that, hey, this is actually helping the side effects of these patients. There's that they're losing weight. So that's usually what happens with a lot of these drugs that get prescribed for, let's say, Viagra, right? Is originally a blood pressure medication. So no, side effect, which is a good side effect, now became the effect. So this is the effect, right? So it's the PPAR. So it's going to help you with an erection, right? So that's Viagra. So that side effect became the effect, and that's now the drug. It's a very, very popular drug. Same thing with Cialis as well, blood pressure medications, okay? So semaglutide now is a very, very popular, very, very expensive weight loss drug. It is injectable, tiny little injection, tiny little bee sting, little ant sting, no problem. Remember, use the code THINK. I am not affiliated with that. You don't help me out. You help Think Big Bodybuilding, and that's their code. So they have other shows that they do, other information that they give out for free for everyday persons and bodybuilders, and useful for powerlifters as well. So, but maybe mentioning my name, Andrew, or fit.dad lifestyle in their comments would definitely help me out. So maybe, I could get my own code. It would help me out. But in the meantime, I don't mind helping Think Big Bodybuilding. I think they're awesome. So use the code THINK on Amino Asylum. Man, you can snag the semaglutide, you can snag, if you need to, some carnitine, the shredder, the Helios. I've done videos on all those. They have so many other products. But that's all I wanted to mention was just, hey, this is what's coming out, man. This is now an affordable way for semaglutide. I just thought it's pretty amazing that Amino Asylum put it out. I think they did a great job.